Congressman, if the House uses the self-executing rule to pass the legislation, will you vote yes?
I prefer an up or down vote on the substance of the bill, but regardless of the procedural mechanism, this weekend's vote is a vote for or against health insurance reform. As I have always supported health insurance reform, I plan to vote for the bill in the affirmative.
Republicans have slammed such a vote, even calling it unconstitutional.
Yeah.
Do you believe the ends will justify the means if you are forced to pass health care reform through this self-executing rule?
Well, this so-called self-executing rule, it really doesn't mean anything to anybody outside of Washington. It's very Washingtonian. The fact of the matter is it's an up or down vote on health insurance reform. The opposing party has used it over 30 times. The Democratic Party has used it as well. Again, this is very Washingtonian. It's not what matters to Americans. What matters to Americans is affordable and high-quality health care. That's the health care that I want for my family. That's the health care that I want for my community. That's the health care I want for my nation. And my vote will reflect that this weekend.
Are Democrats being transparent about this vote?
Democrats, I think, are being very transparent. The provisions of this bill have been made available to anybody seeking that information over the past several months. It's a big industry, $2.5 trillion a year, 17% of the American economy. There's a lot of moving parts. The bill will be made available online for any American to review and draw their own conclusions. I think what's happening here, this has been so politicized and poisoned by Washington politics that the substance of the bill and what we're trying to achieve has been lost in the politics of this thing. The fact of the matter is the current system that we have is unaffordable. It's highly ineffective. Your problems don't start when you're paying premiums. Your problems start when you need health insurance and you're denied because of pre-existing conditions and a number of other issues. So the current system is unacceptable. We need to move. Americans have to embrace change, and I think this is a very, very important step in the right direction.
A majority of Americans agree with most of the elements of the health care reforms, even the public option, which isn't included. But when you ask about the bill in general, polls show they oppose it. Why is that?
I think the opponents of health insurance reform have been very, very effective in confusing people to the extent that they don't embrace something or support something that they don't really understand. I support a rigorous debate on factual information, not mischaracterizations of end-of-life counseling, hospice care, which is intended to provide psychological, spiritual, physical counseling to individuals facing end-of-life issues, that they are deemed by members of Congress as death panels. These are the very things that were supported by the very people who are characterizing them as death panels even 2 or 3 years ago. That is reckless. It's irresponsible. We should have a debate based on fact. And I think once the American people fully understand all of the component parts that are in health care reform, there will be overwhelming support for this bill.
Do you really believe the public wants this reform package?
I do. For the 47 million people without health insurance, for the 14,000 people that lose their health insurance every single day because their employer can't afford it anymore, or they as individuals can't afford it anymore, for the 800,000 people that go into personal bankruptcy every year because of their medical debt, even though they have health insurance, for the thousands of people every day that have their health insurance canceled by private for-profit insurance because they find a technicality in a policy once somebody becomes seriously ill, for all of those who want Cleveland Clinic quality care. They want Mayo Clinic quality care. Americans should be indignant that we pay as much as we do and get the declining outcomes that we do. $2.5 trillion a year, 17% of the American economy. We're 37th in overall quality out of 192 countries. We're 41st in infant mortality out of 192 countries. We're dead last in preventable deaths out of 192 countries. That's unacceptable. Americans should be indignant. We need to do better, we can do better, and we will do better.
What are you hearing from your constituents from Western New York? At least nationwide, the most vocal sentiments seem to be from those who are opposed.
Well, the most vocal are opposed. I'm more concerned about those who are most thoughtful and are willing to take the time to understand what this bill is and what it isn't. And I think a review of this bill, although it's large, it's complicated, the industry is large and complicated. I've learned a lot over the past year about health care, health insurance reform. I still have a lot to learn, and so does everybody else. And I think once you see what this bill represents, it's an opportunity for us as Americans to move away from a fee-for-service reimbursement system to one of overall quality. This is what the Cleveland Clinic adopted 20 years ago. This is what the Mayo Clinic adopted 20 years ago. The Cleveland Clinic and the Mayo Clinic should not be held out as exceptions. That should be the rule, given the investment that we've made in health care. And again, that's the health care that I want for my family, that's the health care that I want for my community, and that's the health care that I want for my nation.
Do you believe this will pass this weekend?
I do believe it will pass. It's not only a debate that's existed for the past year and a half, it's a debate that's lasted for over 100 years, going back many administrations. And if you look at economists and what they say the result of healthcare reform would have been, we would have saved $1 trillion if President Nixon had succeeded. We would have saved $500 billion had President Clinton succeeded. The fact of the matter is, most Americans, most members of Congress support healthcare reform in the abstract, but good God, when you try to put detail on any of those proposals, then you have a divide. What healthcare reform needs in this nation is not a finish, a start. All of the major legislation, Social Security, Medicare, the Clean Water Act, these are bills that were enacted and then improved upon as time went on. That will be the same for healthcare reform. The things that we're doing today will be very different from the things that we do later on. The fact of the matter is, Americans should be leading the world in every measure of healthcare quality, of every measure of healthcare access. We're not right now. Given the amount of money that we've invested in healthcare as a nation, all of us, we should be expecting much more.
Thank you, Congressman.
Thank you.